Hospitals are supposed to be a place of refuge, somewhere you go to cure yourself of some kind of ailment. However, many times the place you might want to avoid the most is actually the hospital you need to go to. That's because the hospital is where all the sick people are. What's more is that there are a lot of really sick or terrible bacteria in hospitals that are proving extremely difficult to treat. We're going to talk about the most famous one of these in this lesson, one that has given you pimples and also killed thousands of people. I'm more than sure you have heard of the term staph infection. It's used almost left and right. However, few people note that a staph infection can cause problems ranging from something as innocent as a pimple to something more serious, like death. The principal disease-causing bacterium of staph infections is known as Staphylococcus aureus, which is a gram-positive coccal bacterium. This means it's a bacterium with a round shape, known as a coccus, and has a very thick cell wall, which is why we call it gram-positive. Also, the reason it is called aureus is because it produces a pigment that gives colonies of this bacteria a golden hue. This golden hue is reminiscent of an ancient Roman gold coin called an aureus. Staph aureus is sometimes found on the skin of even healthy human beings. It doesn't have to be a disease-causing agent. However, if your skin is compromised due to something like a scratch or surgical incision, this bacterium can get into the crack in the skin and cause the typical signs associated with a skin infection, such as pimples, boils, blisters, a rash, itching, and so on. A highly contagious form of bacterial skin infection caused by Staph aureus is known as impetigo and is often found in infants and children. Impetigo is the least of your worries, however. If this bacterium gets into the deeper levels of your body, it can cause far more serious problems. For example, if you go to the hospital to have shoulder surgery performed and proper protocol isn't followed in the hospital during surgery or at home while recovering, then this bacterium can get into your deeper tissues and cause a condition known as septic arthritis, which is inflammation of a joint that is caused by an infection. If left untreated, the joint may be irreversibly damaged and may result in lifelong pain and mobility issues. An even more life-threatening condition caused by Staph aureus is known as toxic shock syndrome and is a condition where toxins produced by Staph aureus cause low blood pressure, seizures, and organ failure. This condition is commonly associated with tampons that are infrequently changed but may also be caused by bacterial entry through any wound in the body. This is by no means a complete list of the things Staph aureus can cause. Nonetheless, any condition caused by a staph infection is generally treated at minimum by antibiotics, which is a general type of medication that can kill bacteria, such as Staph aureus. Unfortunately, in some cases, Staph aureus cannot be treated with important antibiotics. I know I just said that staph infections are treated with at least some kind of antibiotic, but the problem is that we have managed to seriously mess up our ability to fight off this dangerous bacterium. Improper use of antibiotics over many years has led Staph aureus to develop into a much more sinister strain. This specific strain of Staph aureus is known as methicillin-resistant Staphylococcus aureus, or MRSA for short. This is a strain of Staph aureus that is resistant to many beta-lactam antibiotics, such as penicillins and cephalosporins. The reason that this antibiotic-resistant strain of bacteria evolved is very easy to explain. It's like how gazelles evolved to run really fast in order to outrun cheetahs. Had they not, their species would not have survived. In this case, one species evolved to counter the skill of the other. Just because bacteria are smaller than, and perhaps not as intelligent as animals, doesn't mean they can't evolve either. In the case of this specific bacterium, we used weapons, known as antibiotics, improperly. When we improperly use these antibiotics, we let the stronger Staph aureus bacteria survive. Had we properly used the antibiotics, these stronger members of the species would have died out as well. Since we did not, we let them get away and reproduce. Therefore, their offspring now carry the genes that help MRSA outwit our standard antibiotic weapons. That's why we've had to develop dangerous, expensive, and rare super weapons in order to fight MRSA off. One such traditional weapon is an antibiotic called vancomycin that has traditionally been known to be the antibiotic of choice and last resort in the fight against MRSA. You shouldn't be surprised then that MRSA, like its non-resistant Staphylococcus aureus brethren, causes havoc in hospitals precisely because it loves to take advantage of sick people and because so few treatment options exist. If not treated immediately, death is almost certainly guaranteed. That's why if you are ever prescribed a course of antibiotics, you must finish it as per your doctor's instructions. If you do not, you can become a breeding ground for antibiotic-resistant bacteria that can kill you and others the world over. Let's review the main points of this lesson one last time. The principal disease-causing bacterium of staph infections is known as Staphylococcus aureus, and it is often associated with skin infections. A highly contagious form of bacterial skin infection caused by Staph aureus is known as impetigo, and it is often found in infants and children. There are more serious consequences to a staph infection, however. Septic arthritis, which is an inflammation of a joint that is caused by an infection, and toxic shock syndrome, a condition where toxins produced by Staph aureus cause low blood pressure, seizures, and organ failure, may occur. Finally, improper use of antibiotics over many years has led Staph aureus to evolve into a much more sinister strain. This specific strain of Staph aureus is known as methicillin-resistant Staphylococcus aureus, or MRSA for short. This is a strain of Staph aureus that is resistant to many beta-lactam antibiotics, such as penicillins and cephalosporins.